back. May is Foster Care Awareness Month, and right here in Houston is one of the nation's only multidisciplinary foster care clinics. But what does that mean for Harris County? This morning we're joined by Dr. Mackenzie Hughes, a child clinical psychologist at Texas Children's Hospital, to kick off this really important conversation. Good morning, doctor. Thank you for being here.
Good morning.
Okay, so we're talking about Foster Care Awareness Month, but families at home are watching. What is the current situation for foster care here in the Houston area? And I'm sure there are a lot of kids that are dealing with this.
There are, and the needs are significant. There's over 4,000 children in our area who are in foster care, with over 1,100 children placed into foster care last year.
Wow.
In our area, children are on average in foster care for over 2 years and are in at least 3 different placements.
Yeah.
That
is like really hard for a kid to have to go through to navigate that challenge, right?
Absolutely. Children need safe and consistent caregivers, and moving around significantly impacts their development. One of the really unique things about our foster care clinic is that we're able to follow these children if and when they move placements to provide that consistency in addition to coordinating their medical and mental health care.
That's huge. We'll talk about that in just a bit, but really kind of touch on some of these mental health challenges that these kids are faced with before maybe they go into the clinic and you guys can follow them around.
Children in foster care are 3 to 4 times more likely to be diagnosed with a mental health condition compared to their peers. And given the cumulative and often chronic trauma that they experience, they are twice as likely compared to veterans to be diagnosed with post-traumatic stress disorder or PTSD.
That is heartbreaking. That is just heartbreaking to know.
Yes.
Because I'm sure obviously the trauma that maybe they have gone through to get to that place, but just moving from maybe foster care to foster care, kind of getting close, with a family and then just having to move again, that can't be easy.
Absolutely. The abuse and neglect, in addition to the repeated loss associated with these placement changes.
Let's talk about the clinic and how you were saying that you're able to maybe follow the kids along and keep track of how they're improving, because that's what it's about, right?
Absolutely. Our foster care clinic is one of the only multidisciplinary clinics in the nation that specializes in treating children in foster care. One of the really unique things about our clinic is that all new patients get a multidisciplinary assessment. So they see a medical and a mental health provider at once. That means they don't need multiple visits. They don't have to repeat their story multiple times.
Yeah.
During that assessment, we provide a comprehensive and individualized treatment plan to support the child's healing.
Yeah, and that's probably huge.
Absolutely. And one of the really unique services that we provide in our clinic is a type of therapy called trauma-focused cognitive behavioral therapy, or TFCBT.
Okay, what is that?
It is the most widely used and most effective treatment for childhood trauma.
Okay.
It is really the gold standard for treating trauma.
And can that kind of help them to get past it in a way?
Absolutely.
Okay.
To heal from the trauma that they've experienced. And on average, children in our clinic complete TFCBT in about 25 sessions.
Wow.
That means that even though they may have gone through years and years of abuse and neglect, they can heal in a relatively short amount of time.
That is amazing.
It is. And our clinic is one of the only places in our area that is providing this incredibly necessary service to children in foster care.
Tell us about the support as well for caretakers and foster parents, because I'm sure, it's hard for them to say goodbye or
Absolutely.
to have to not be able to see their foster children.
Yes. And caregivers, including foster parents and kinship caregivers, are absolutely integral parts of the healing process for children. Yeah. And children don't come with a user manual. And there certainly isn't a guide to how to parent a child who's experienced really significant abuse and neglect. One of the really unique services that we provide in our clinic is a type of service called parent management training, or PMT. Through this service, we provide caregivers the skills to help to respond to common behavioral concerns that children experience after they go through trauma, and giving them the skills and really empowering them to help support the child through the healing process.
That is so huge. Okay, tell us about the impact that this clinic has had, because I'm sure you've seen it. I'm sure you've talked with families. You know, you are seeing the changes.
Yes. One of the amazing things that our clinic does is we have graduation celebrations when children graduate and complete TFCBT. Yeah. And this is just such a great opportunity to celebrate the huge accomplishment that it is to complete trauma therapy, in addition to really reflect on how incredibly strong and resilient these children are.
Yeah.
One case that really comes to mind is a child who had gone through years and years of abuse and neglect, and by the time the child came to see me, had been in at least half a dozen placements in the last couple of years. This child was really suffering with severe PTSD symptoms and was just struggling in all areas of their life. In a short amount of time, this child graduated from therapy. They were on the soccer team, doing band at school, had close friends, and just a couple weeks after their therapy graduation, they were adopted and got to have their forever family.
Oh my goodness, it sounds just incredible to be able to be a part of this.
It is. It is such an amazing joy to get to walk through the healing process with these kids.
Dr. Hughes, if folks are watching and they are interested in learning more, maybe reaching out to you guys for more information about the program, where can they find you?
Calling our Texas Children's Foster Care Clinic at 832-824-6522.
And do you have maybe a message out there to anybody that is experiencing this, trauma, especially children or families of children? There is always hope. There is always a way to heal.
Absolutely. There is hope, and things can get better with appropriate services and support.
All right. Dr. Mackenzie Hughes, thank you so much for being here with us.
Thank you.